Did you know that more frequent or less frequent urination can be an indication of kidney disease? Well, welcome to this YouTube platform, Health Tips and Tricks. I am your physician, Dr. Andrew, to take you through. And if you're new to our channel, kindly subscribe so that you continue receiving information about your health and how you can live a better health. So today we are going to look at what are some of the things that you can notice on your body, and they show you that you could be developing kidney disease. This is a follow-up from the previous video we made that was on kidney disease, and if you missed it out, feel free to check it out on our page and catch up with us. So these are some of the features that you can notice. Most commonly, these are common among, you have things like nausea and vomiting. These are common symptoms of any disease, and if you notice you have nausea and vomiting that is kind of persistent, then this could be a time to do a kidney checkup. And then we have loss of appetite. Again, loss of appetite is also related to nausea and vomiting. If someone is vomiting, they will also have a reduced appetite. This can also be an indication that you have kidney disease. So all these features are related to what happens when you have kidney disease, in that your body is not able to get rid of certain toxins. So once these toxins are retained in the body, because your kidneys are not functioning, they can lead you to get nausea and vomiting and even reduced appetite. And then we have feeling fatigue and weakness. The kidneys are important in the body because they help us to balance our electrolytes. And by electrolytes, we mean salts like sodium, potassium, phosphate. So once the kidneys are sick, these electrolytes are not well balanced. And some of these are necessary for your muscles to function, for your muscles to do activity, to help you with activity. So it makes you feel fatigue all the time. And with this, you can also get weakness and also muscle cramps. Maybe you've been doing an activity, you've been walking to work every day, but you notice that now when you walk to work, when you do your usual work, you feel muscle cramps, you feel fatigued, more fatigue than usual. So this could be a sign that you're developing kidney disease and need to go for checkup. You could also get sleep problems. Like we said, the kidney helps to get rid of toxins from the body, including urea and other toxins. So once these toxins accumulate in your body, because your kidneys are not functioning well, they can affect the functioning of the brain, and you end up having sleep problems and also things to do with your memory and your critical thinking. People will start noticing that you're not your usual self. So some of these can be an indication of kidney disease. And then we have, of course, we talked about urination as our catchphrase. So if you have frequent urination or even reduced urination, maybe you've been going to the bathroom 4 times a day, and you notice that you now go once, and even when you go, the amount of urine you produce is very little. It has reduced significantly. This could be a sign that you're developing kidney disease. And also frequency. Sometimes the frequency might be increased. So this can also be an indication that you're developing kidney disease. So any changes in your urine pattern, in your urination pattern, should be reported to your physician or to your doctor for a kidney checkup. We talked about decreased mental sharpness in relation to sleep problems. So people notice that you're not as sharp as usual. Your memory is going down because your brain is being affected by some of the toxins that are being retained because of the kidney disease. Body swelling. This is a common thing. Sometimes you can get body swelling because of different conditions, different things that could be going on with your body. But body swelling is a common sign that you're probably developing kidney disease. So if you get body swelling anywhere in your body, particularly the swelling that happens in the face as you wake up in the morning, and as the day goes by, it starts going down. So this can be sometimes noticed by your friends, maybe your neighbors, maybe the people you stay with at home. They tell you, but in the morning when you wake up, your face is swollen. But in the evenings, you come back when you're okay. So this can be an indication that you're developing kidney disease, and you need to report this to your physician. Skin. The skin can also get several things. One, you could have a dry and itchy skin. And this is a common sign that you're probably developing kidney disease. You could also get changes in the color of the skin. And all these can be an indication that you probably are developing kidney disease. And then we have, of course, blood pressure. In order to be healthy, you have to be monitoring your blood pressure daily. If possible, you can acquire a machine at home, or you can visit your doctor or the nearest health center or hospital and constantly monitor your blood pressure. So if you realize that your blood pressure is going above normal, and by normal we mean, for example, a young person, we want you to be around 120 to 130. So if you realize your blood pressure is exceeding, is going above that, and as you measure it, you realize it's going above. So this could be the time to go for a checkup for your kidneys, because it is one of the causes of a raised blood pressure. Some people develop shortness of breath because the kidneys also help to take out of the body excess water. So if some of this excess water is retained, it could cause you to have difficulty in breathing because it accumulates in the lungs and makes your breathing difficult. So if you get difficulty in breathing of any kind, it could be an indication that you're developing kidney disease and you may need to do a checkup for your kidneys. Chest pain. The same way water accumulates in the lungs because it is not being put out by the kidneys, it could accumulate around the heart, and this could give you chest pain, which is normally central. But it could also make you get fatigued easily, and all this can be an indication that you're probably developing kidney disease. Now, as you notice, most of these symptoms we have talked about, they are non-specific, meaning that any other disease can also have them. So that's why we need to always be keen and attentive to what is going on in our lives, so that in case we get any of these, maybe persistently, then it will be time to visit your physician or your doctor just to be on the safe side. And as we all know, okay, maybe this is new to some of us, the kidneys have the ability to adapt their functionality. If you start developing kidney disease, maybe a small portion of your kidneys is being affected, the remaining portion, which is normal, will compensate for the loss of function of the damaged part of the kidneys. For example, if your kidneys are 100%, and then 20% maybe becomes affected by a certain disease, the 80% will adapt and will carry out the activity or the duties which were being performed by the 20%. So most times, actually, you never realize that you have kidney disease until it is too late, because if your kidneys are starting to decline, the remaining part will do the duties or the activities of the damaged part. So sometimes it can be difficult for you to know that actually you're developing kidney disease. And that's why routinely, as part of your health checkup when you go to see your doctor, you should check your kidneys, especially if you have the risk factors we talked about in our previous video. And if you missed it, you can check it out on our platform so that you catch up. And then also, if you have any risk factor in your family, like I have said, or if you have other risks, for example, diabetes, hypertension, you should constantly get checkups for your kidneys from your physician or from your doctor. Thank you for your attention. I remain your physician, Dr. Andrew. I hope this was helpful and it's going to help us live a more healthy life and prevent kidney disease among us and our relatives. Thank you very much.